So with diabetes, is it safe for diabetics? And so diabetics do need to work with their healthcare provider, especially if you're type 1 diabetic. The concern is always diabetic ketoacidosis. And again, if you have insulin in your system, it's impossible to go into ketoacidosis. So talking about blood levels, where we're aiming for that 1.5 or a 2, ketoacidosis would be blood levels upwards of a 20. So it would be extremely difficult to get that high. Even drinking exogenous ketones, you'd have to be drinking like 40 packs of ketones in a day to try to get a blood level even close to that high. So it's very difficult to achieve if you have insulin in your system. If you're not making insulin, like a type 1 diabetic, then yes, that is a risk. So for type 1 diabetics, I always say you have to work with your healthcare provider. You have to be a controlled diabetic. So you're regularly managing your blood ketone levels and your blood sugar levels, and you're taking your medication regularly, and that's the only time I would say anyone should even consider engaging in a ketogenic diet or taking exogenous ketones. And then for type 2 diabetics, if they're late stage and now they're taking insulin, they would also have to be concerned. And so you need to work with your healthcare provider, and you do need to be monitoring your blood ketones and your blood sugar. So I've been